Hi, greetings. This is Dr. John Bennett, broadcasting from Miami, Florida. I am the owner and creator of the website internetmedicine.com, and we occasionally do Google Hangouts with web developers that have uh, made applications or glassware in this case. And today we're talking to Kyle Samani, the CEO of Pristine.io, which has made an exciting application or glassware application for Google Glass called Pristine.io, which includes the eyesight part and a checklist part, which I just discovered. So Chris, I imagine, is down in Austin, Texas, where they just had a big conference, which I'm sure he was at. Chris is going to tell us about his product, and after his presentation, I'll be asking some questions. So it's all yours, Kurt. It's all yours. Take it away.
All righty, John. Thanks so much. I appreciate it. Good morning, everyone. This is Kyle. I'm a founder and CEO of Pristine. I'll give you guys a quick run through of our team, our company, and kind of what we do. So I'm going to turn on a screen share here, and you should be able to see my screen now. So I am a co-founder and CEO of Pristine, and we are developing telehealth solutions for Google Glass. If you guys have any questions, please don't hesitate to reach out and email me. You can email me at kyle@pristine.io, and you can reach me at any time there, or you can visit our website at www.pristine.io. And our company is based out of Austin, Texas. So some quick facts and figures about us. I founded the company about a year ago in May of 2013. We have 9 full-time employees now. We are VC-backed, and our headquarters are in downtown Austin, Texas. And we're installed in 4 hospitals today, and we're expecting to be installed in 8 by the end of this month. So lots of exciting action coming up as the product starts to roll out. Our team, real quick, here's just some of our leadership. Some of the highlights: I led design and development of an EMR in my prior job. My co-founder and I have been friends since high school computer science class, Patrick. Brett Hogan, who leads our client success initiatives, spent the last 6 years at Accenture leading large telehealth projects. And our other independent board member, Bob Fabio, is a 4-time entrepreneur and 2-time venture capitalist himself. And he's also the founder and CEO of White Glove Healthcare, which is a great healthcare organization. We're also really proud to have a great advisory board around us, and we have some great physicians from Mayo Clinic, from Banner Health, and from the Core Institute and other places helping us out. So I always like to start presentations off by telling folks, why we do what we do. And what we've come to realize is that we really believe that telehealth is the most effective way to achieve the triple aim of higher quality, reduced cost, and improved access. Telehealth is so effective in helping connect patients to providers, and by connecting them in ways that weren't possible or practical before, we can improve access and supply and ultimately drive up quality and drive down costs at the same time. So we're really, really big believers in the future of telehealth. But having said that, a lot of the telehealth solutions out there are just really cumbersome to use, especially the big Cisco and Polycom carts. They're just not particularly elegant. And then looking at a device like Glass, we got to realize that hands-free computing is going to really be big in changing how providers interact with computers at the point of care. And so kind of the culmination of the 3 above led to the starting of our business. The problem we're really addressing is that patients need to connect with the right specialist at the right time. And it's an access problem, right? And so at any given location, there's almost always an imbalance, a supply and demand imbalance of specialists to care providers. If you're a patient, let's say, and you're in a hospital and you need a cardiologist, if there's not a cardiologist around, then you're going to be waiting hours or days for that cardiologist. And so it's a very, unfortunately, binary situation when getting access to the right care. And so our goal is, by making location irrelevant or making a location no longer matter, we can dramatically increase the supply of available physicians to ultimately increase access to care and drive up quality and drive down cost. And here's just a few of the different specialties out there that are visual in nature that we are helping bridge. So what does our solution do? Well, our solution is called Pristine Eyesight, and it's the first and only HIPAA-compliant audio-video streaming solution optimized for Google Glass. What I love about this picture here is that it shows our product in action in a single still. So we can see here our physician is looking at this patient's hand, and over here on this tablet we can actually see the first-person video feed from his perspective. So this is a great, and this is a live video feed, and there's two-way audio. So that means the person wearing the glass can talk with the person who has the tablet, and the person who has the tablet can talk, and the person wearing the glass can hear them. So it's a fantastic way to do telehealth. What's so compelling about this is that it's in first person and it's hands-free. So it's just really, really great way to do telehealth so that the local provider doesn't have to fiddle with this other thing. We don't want providers holding iPhones and doing this awkward thing in front of the patient, or holding iPads, or trying to set up these big ugly carts, and the carts are just really heavy and cumbersome to use. Our solution is, super lightweight, easy to implement. It's just 7 ounces. The glasses are so light, and they're really, really passive and easy to use. So we're super excited about making this a reality. And this video, by the way, is running at full 720p. It's great looking HD video that's great for diagnostics. So we have a video of our product in action at Brown University where we're live. I'm going to skip that video for now, but you guys can check it out at our website. So kind of if you look at how telehealth is done today, there's a lot of different ways people have been trying to do telehealth. The carts are the most common. Some people have stationary base stations. More recently, people have tried these robots that drive around. But the problem with all of these solutions is that the camera angles are relatively fixed. You don't get the flexibility of having a human neck, having a waist, and having wrists, and having a first-person perspective of that local provider. And so we've actually been pretty, we found that although these other devices are functional, they're not great at delivering a good experience. And ultimately, in many cases, they can actually cause more problems than they solve. People have tried using iPhones and iPads, but of course the problem is that you have to use your hands. And so it's just a really awkward solution for both the patient and the provider. If you're going to do 4 or 5 minute consults, the provider's arm is going to start to get tired. Of course, they're now losing an arm that they can't work with, and it's just an awkward experience overall. So we really feel that glass is the most compelling way to do this. What's even better about our solution is that it's super IT friendly. Our solution is the lightest weight solution in the market in both physical terms and virtual terms. We work on all existing devices hospitals have. So to receive the video, they can receive video on iPhones, iPads, Android devices, Macs, and PCs. And then, of course, the video can be sent from glass. But what's super cool is that it requires no new hardware. It's all cloud hosted. And the best part is on all of the existing PCs, they don't even have to install anything. They literally just have to, our users just go to a URL, for example, test.pristine.io or something to that effect, and literally they just log in on their browser and everything runs in the browser. It's super easy, it's super seamless from an IT management perspective and from users and training, and there's no configuration or setup whatsoever. So we're getting a lot of great feedback from IT teams that really like working with our product because it's so easy to deploy. So we're live now with a few different organizations. We're live in 4 hospitals. These guys, Irvine and Brown are in their obvious locations. Botsford Hospital is up in Detroit. The Advanced Heart Care is a group of physicians that run ICUs out of Dallas. So the next few slides, guys, I'll just outline quickly, how our product is being used. So Brown University is actually using our product to feed live. They're doing consults into the emergency room. So if they need a cardiologist or dermatologist or trauma specialist, they're actually beaming those people in remotely through glass into the ER to help provide better care. Ambulances, we actually just signed our first ambulance deal yesterday. We're super excited about it, and we're going to be helping beam trauma specialists, cardiologists, and neurologists out to ambulances all over the country. Super, super excited about that. We're also now live in surgery and anesthesia, where the surgeons are beaming live and first-person video for consultations and education, and anesthesiologists are using this to help provide additional coverage for nurses who are delivering anesthesia services in non-OR areas. So, for example, there's now nurses delivering anesthesia in emergency rooms, in GI labs, in the cath lab, and other areas, and so we're helping increase their coverage ratios by asking the nurses to wear glass. The anesthesiologists who are in the operating rooms can now see what's going on elsewhere in the hospital through the eyes of the nurses. So a lot of interest there. We just had our first ICU go live a few weeks ago, where they're now using our solutions on both. We're powering both the carts and the glasses, so they can beam in on the carts and the glasses. It's super, super easy for them to do that, and they're now doing tele-ICU care with our platform. We also just landed our first deal in a medical education environment where they're going to be incorporating both live and recorded video content into the medical education process. So you can imagine things like virtual rounding, where 6 or 7 students can now watch one student go into a room and deal with a patient, and they can pause and debrief the video. They're going to be incorporating content into anatomy labs. They're going to be incorporating content into a whole host of places to really improve the medical education experience, and we're super excited about that. And then, of course, we're even powering use in nursing homes, where these guys are actually shipping glasses off to nursing homes, and they're powering the staff to work with elderly patients that have a lot of pressure ulcers, chronic wounds that don't heal, where the nurses need to be hands-on with the patients, and they want that physician consult from the hospital or from their clinic. So we're seeing lots of great interest from folks who want to use the product in different places. So then kind of just to summarize all of the above, we're the only HIPAA-compliant telehealth solution today that's optimized for Google Glass. We can stream video between any device anywhere in the world. It's all cloud-hosted, no configuration or setup. We have fantastic video performance on Glass. And ultimately, we're dramatically reducing inefficiencies across the continuum of care. So with that, John, I think I'm going to turn it back over to you, and we can do some questions.
Excellent, Kyle. Personally, I've never worn glass, but I certainly am curious, and I can see how it's going to occupy a bigger and bigger spot in medicine. I just have so many questions. First of all, I went to Brown, which is kind of nice. You're doing that at Brown Hospital. Are you a Longhorn, Hook 'em Horns?
I actually did not go to UT. I actually went to New York University, although I'm from Austin.
Okay, you're in Longhorn land, right, in Austin?
Yep, I am in Longhorn land. We can actually see the UT football stadium from our office.
Oh, great. Yeah, there's a lot of questions I have. I can see how there's certain areas of the hospital which are it works better. I noticed on your website for wound care. Could you remark a little bit about the wound care indication for your platform?
Yeah, absolutely. So we're, it's a great use of wound care where, we've got, a lot of chronic wound care. Most wound care physicians work in outpatient clinics, and so there's a lot of inpatient wound care patients. It's oftentimes difficult for the physicians to get into the hospital and see those patients. So we now have nurses who go on rounds daily, and they use the glasses to beam physician consults into the wound care the hospital. We're also seeing similar interest from chronic wound care management from patients who are at home, where they have nurses visiting the patient in their home, and they're now doing a live debridement of the wound while they're using the glasses to beam the video for remote instructions and care. It's really fantastic.
Yeah, that seems like a great indication. It's funny. Before I even knew about your Pristine, I was talking to a trauma surgeon in Maine named Raphael Grossman. I don't know if you know Raphael, but I was trying to encourage him to do some studies in emergency response up in Maine, because he uses the iPod now for ambulance crews when they go onto a remote site to transmit the images back to him in the trauma center. But I was saying to Raphael, wait a minute, Google Glass is made for that, because the technicians, they need their hands, and you mentioned that. Sometimes the healthcare professional needs their hands, and something like this is just the thing for that. They don't have to hold a camera.
Yeah. Oh, yeah. So I've actually spoken with Dr. Grossman many times. We're actually working with his organization now. We're super excited to get him up and running on the system. I think he's been a little slow with bureaucracy and administration and such, but we're making great progress, and we're really excited to help them use real telemedicine through Glass.
Well, Kyle, you mentioned bureaucracy. I'm surprised you move pretty fast. You started in 2013 and already HIPAA compliant. How the heck did you do that?
Well, yeah. So we are very fortunate. Myself, prior to founding this company, I led design and development of an EMR system. So I'm already very, very familiar with HIPAA. It was obviously a big part of my last job. Our team we have an amazing engineering team that's been able to do some really great stuff and leverage a lot of good open source libraries and security protocols to make everything come together. We've had our independent auditors run through the system now, and they've certified it. So we're feeling great about it, and it's just been a lot of hard work.
Well, you're doing a great job, man. It's funny. I noticed too that you work with UC at Irvine. Do you know that Wayne Weichman? Are you familiar with Wayne?
I know a guy named Warren Weichman there. I don't know Wayne Weichman.
Well, he essentially led the change in the medical curriculum at University of California at Irvine. It is now completely iPad based, and they were one of the first schools to do that. So I'm not surprised that they're one of the first ones to use your platform. They're very tech smart at the University of California at Irvine, and most of it's due to Dr. Weichman, I believe. He really opened up the doors.
We're talking about the same guy. Warren's a fantastic guy. I love Dr. Weichman. He's actually, I had a call with him yesterday.
Yeah, he's a real pioneer in medical education. To get the curriculum changed at a medical school to be iPad based is a tremendous accomplishment. But the other schools are following it. Dartmouth now, I don't know if Brown's doing it. Cornell's doing it now, and the other schools will eventually become iPad based, where the students study before they come to class, and they just ask questions. But I won't get off. That's another topic altogether. I noticed Google Hangouts are not used with Google Glass at this point. Could you comment on that at all?
Yeah, so Google Hangouts actually used to be built into Google Glass, and with the most recent software update as of about 2 weeks ago, Google made the decision to remove Hangouts from Glass. We believe the reason they did that, there's a few of them, but Google was struggling with some performance issues. So ultimately today, Hangouts aren't in Glass. But honestly, that doesn't really affect our solution. Our solution is empowered by Hangouts. Our solution is running through our, the problem with Hangouts from a healthcare perspective is it's not HIPAA compliant. Google's not sending BAAs, and it's not encrypted. And so it's been kind of a challenge for Google to really make a strong headway into healthcare. And so we went ahead and said, we're going to do everything that you really need to make this system enterprise friendly. So obviously HIPAA and encryption and BAAs, but then we do everything else around that. So we provide really robust dashboards so IT can manage the system. We provide usage metrics. We do all kinds of integration into existing infrastructure. So there's a lot of other things we do that obviously an off-the-shelf solution would never do.
Well, this tech will find its place in various medical settings and various niches. But one setting I see it very useful for is, of course, education. And when surgeons operate, as you alluded to, maybe you're in your talk or on your website, is that it helps to have the camera up close on the surgeon's head so that you can see the surgical field, and the surgeon is able to teach much better than if the camera's over the shoulder trying to show the surgical field. And I know that there's some hand surgeons I've been talking to that I think that would welcome. I don't know if they're incorporating education with Eyesight and Google Glass, but they're starting to use Google Glass. Hand surgeons are starting to use it in the operating room, and I'm not sure about the state of the art as far as using Eyesight to transmit to students, but that seems like a good setting to use it on. It seems like it would be useful. So anyways, Kyle, I thank you very much for taking the time out to talk with us today, and certainly we'll try to educate various medical niches on the existence of your technology. And anything in the future, anything in the near future for you, for your tech?
Yeah, I mean, there's a lot of great things we're working on. We're not really allowed to talk about some of the things that are coming up, but there's, we can promise you a whole bunch of really, really cool features we're going to be unveiling over the next few months. We also just signed a couple of really, really big accounts, and we're going to be really excited to announce those partnerships over the coming months as well. So great things are coming.
Okay, Kyle, we'll keep an eye on what's going on your website. And hang around, I'm just going to stop the broadcast, okay?
All right, thanks so much, Sean.